1. A direct care worker must integrate adult learning principles when mentoring a new colleague. Which approach best reflects this practice? A. Relying solely on written policies without discussion. B. Encouraging reflection on prior experiences to build new skills. C. Providing only demonstrations without feedback. D. Requiring rote memorization of procedures. 2. Which evaluation method most effectively measures a direct care worker's competency in infection control practices? A. A multiple-choice knowledge exam. B. Observation of practice using a skills checklist. C. Peer feedback through surveys. D. Self-assessment journals. 3. When developing curriculum for direct care worker training, which element ensures alignment with regulatory compliance? Including personal anecdotes from experienced staff. B. Structuring modules around state-mandated competencies. C. Allowing learners to choose topics freely. D. Excluding assessment to reduce stress. 4. A new direct care worker demonstrates difficulty with communication during patient handoff. Which mentoring technique is most effective? A. Modeling best practices and encouraging practice with feedback. B. Assigning additional reading on communication theory. C. Providing general encouragement without correction. D. Ignoring mistakes to build confidence. 5. Which of the following best represents a regulatory compliance issue in direct care practice? A. Documenting client progress daily. B. Using personal judgment to skip hand hygiene. C. Communicating with interdisciplinary teams. D. Attending continuing education. 6. When training adults in personal care procedures, what principle should guide instructional design? A. Presenting content without context to simplify delivery. B. Connecting training to real-world responsibilities and outcomes. C. Delivering long lectures with minimal interaction. D. Providing only written manuals for review. 7. A supervisor designs a pre-test and post-test for direct care worker trainees. What is the primary purpose of this evaluation method? A. To measure enjoyment of the training. B. To assess knowledge retention and learning progress. C. To compare trainees against national averages. D. To fulfill accreditation requirements only. 8. Which communication technique best promotes trust between a direct care worker and a client? A. Using medical jargon to establish authority. B. Listening actively and responding empathetically. C. Limiting eye contact to maintain distance. D. Correcting client statements immediately. 9. In mentoring a direct care worker, which strategy best supports long-term skill development? A. Conducting one-time orientation with no follow-up. B. Providing ongoing feedback tied to performance goals. C. Limiting access to experienced staff to foster independence. D. Focusing exclusively on theoretical knowledge. 10. During evaluation, a supervisor notices a direct care worker struggles with safe transfer procedures. What corrective approach is most effective? A. Provide immediate verbal feedback and schedule retraining practice. E. Record the failure without intervention. C. Wait until the annual review to address it. D. Issue a written reprimand without explanation. 11. Which adult learning technique supports direct care workers in mastering complex caregiving tasks? A. Simulation-based training with debriefing. B. Silent reading of technical manuals. C. Watching training videos without discussion. D. Memorization drills without application. 12. A direct care worker training program integrates role-playing exercises. What learning outcome is this most likely to improve? A. Retention of technical vocabulary. B. Ability to apply communication skills in real situations. C. Memorization of state regulations. D. Awareness of organizational hierarchy. 13. Which of the following is the most reliable way to document competency of direct care workers for compliance purposes? A. Attendance sheets from training sessions. B. Signed self-attestations of knowledge. C. Supervisor observations with standardized checklists. D. Informal peer discussions. 14. A mentor notices a new direct care worker is hesitant to ask questions. Which strategy best promotes open communication? A. Reassure them that mistakes are learning opportunities. B. Avoid direct interaction to reduce pressure. C. Only provide answers when asked formally. D. Encourage them to learn exclusively from manuals. 15. What is the most important consideration when designing evaluation tools for direct care worker skills? A. Ease of administration over accuracy. B. Alignment with regulatory and job performance standards. C. Ability to entertain participants. D. Focus on abstract theories rather than tasks. 16. When supervising, how should feedback be delivered to align with mentoring best practices? A. Publicly pointing out errors for peer learning. B. Providing constructive, specific, and timely feedback. C. Waiting until the end of training to summarize. D. Limiting feedback to positive comments only. 17. Which communication strategy most effectively ensures accurate documentation by direct care workers? A. Using standardized terminology and clear formats. B. Allowing workers to choose their own documentation styles. C. Prioritizing speed over accuracy in charting. D. Encouraging brief notes without detail. 18. In adult learning theory, which factor most influences a direct care worker's motivation to learn? A. The potential for immediate application of skills. B. Length of the training program. C. Complexity of the evaluation methods. D. Instructor's level of authority. 19. Which mentoring technique strengthens critical thinking in direct care workers? A. Asking reflective questions about client care scenarios. B. Requiring strict adherence to scripts without variation. C. Limiting discussions to factual recall. D. Avoiding problem-solving exercises. 20. Which curriculum development principle ensures inclusivity in direct care worker training? A. Designing content accessible to varying literacy levels. Standardizing all content to advanced academic standards. C. Using only text-heavy materials. D. Ignoring learner diversity. 21. What is the primary role of formative assessment in direct care worker training? A. Measuring regulatory compliance at the program end. B. Providing ongoing feedback to support learning progress. C. Evaluating staff for promotion decisions only. D. Certifying workers' credentials. 22. Which behavior by a direct care worker reflects a failure in regulatory compliance? A. Documenting vital signs accurately. B. Sharing patient records with unauthorized individuals. C. Participating in required safety training. D. Following emergency protocols. 23. When a direct care worker receives mentoring in time management, which outcome is most likely? A. Improved adherence to care schedules. E. Increased ability to memorize regulations. C. Greater reliance on supervisors for decisions. D. Reduced focus on client needs. 24. Which type of evaluation best determines if direct care worker training content improves job performance? A. Reaction surveys about course enjoyment. B. Post-training observation of real work tasks. C. Written quizzes only. D. Group discussions without follow-up. 25. To improve communication among care team members, which training activity is most effective? A. Case study discussions emphasizing interdisciplinary collaboration. B. Memorization of organizational charts. C. Silent reading of communication guidelines. D. Watching unrelated motivational videos. 26. A curriculum for direct care workers includes learning objectives written in measurable terms. This design choice ensures A. Outcomes can be clearly assessed and verified. B. Learners will not need evaluation. Training length will be minimized. D. Workers can interpret objectives freely. 27. Which adult learning strategy best engages direct care workers during mandatory training? A. Incorporating interactive, case-based scenarios. B. Delivering extended lectures without interaction. C. Requiring only independent reading assignments. D. Limiting discussion to trainers only. 28. When mentoring, what is the best way to encourage reflective practice in direct care workers? A. Asking them to analyze their decision-making after care tasks. B. Providing step-by-step instructions without variation. C. Discouraging discussion of errors. D. Repeating policies word for word. 29. Which element of communication is most critical in emergency care situations for direct care workers? A. Accuracy and clarity of information shared. B. Use of professional jargon to impress staff. C. Speaking at length, regardless of urgency. D. Avoiding direct statements. 30. Which method is most effective for ensuring regulatory compliance training is retained long-term? A. Periodic refresher courses with practice-based scenarios. B. One-time orientation sessions only. C. Informal staff reminders during breaks. D. Posting policies on bulletin boards.